Welcome to another of our short Cogtrium networked support videos. What the purpose of this video is to describe what Cogtrium telehealth is and to give you some idea how it benefits therapists and patients. This is an area of exciting, transformational, changing technology that is occurring. And one of the benefits that is happening because of your Cogtrium membership is that you have access to the Cogtrium telehealth platform. This is done at no cost for software and no expensive equipment and setup. In fact, all of the equipment probably exists in your office already. What I want to talk about is how telehealth can impact your practice. Telehealth is that ability to engage a patient at a distance. It is usually some combination of video, voice, and data. It goes by a lot of names. Sometimes it's called telepsychiatry, teletherapy, teledoctor, telemedicine, and telehealth. They all mean the same thing, and they're all around that same sort of component, that you can see the patient, that you can talk to the patient, and that you can exchange data with the patient. One of the huge advantages for a patient is that it occurs in the convenience of their home or other convenient setting, such as a school or a clinic or a place that the patient can feel comfortable with. This is an amazing step forward. It's one of those things that allows us to reach patients where they are, in the setting where they are. And since we're dealing with cognitive disabilities, so many of those things need to be addressed in the location where the issues are occurring. And this gives the therapist that ability. One of the huge benefits to the therapist is that it extends the reach of the patient's office. It means you're no longer bound to the four walls of your office and doing all of the things that you need to do within those four walls. Distance is no longer an issue. Schedules can be much, much more flexible. And a therapist that has special skills with a certain type of therapy or special skills and understanding of certain populations can reach more patients that can benefit those. A major problem with specialization is that, sure, you get better and better at dealing with specific kinds of issues, but sometimes those patients aren't always just around your office. This allows you to have extensive outreach, be able to reach and benefit far more patients. Referrals and collaborations can be more easily managed. Think of autism as an example. Autism is one of those spectrum disorders where it isn't a single disease or a single condition, but a collection of different things that are treated similarly and seem to have similar effects on the cognitive workings of human brains. Because of that, the approaches in therapy and treatments involve a lot of different kind of medical specialties. There can be individuals that are licensed because they have a BS degree. Some sorts of activities require a master's degree. Others require a PhD or an MD in order to engage in the activities. That requires collaboration between the team that is treating many of these cognitive disorders. Telehealth allows that to happen. The thing to keep in mind is it breaks the bounds of the traditional office location and improves that. If you think of the barriers to care, the kind of problems that you're facing on a daily life, the reasons patients can't get to you, travel is a major issue. If you're in a rural area, that may mean long drives to achieve therapy. If you're in an urban setting, if your office is on one side of town and your patients live on another, it can be a nightmare to get there. All of us are experiencing significant problem with missed appointments. The CDC has been tracking and monitoring that for another number of years. And they're finding in most specialties and most therapies, including those of cognitive disorders, somewhere between 30 and 40% of visits don't occur, that they're no-shows. A huge waste of time, a huge loss of resources. Telehealth removes many of those barriers and lets us be able to deal with the problems of access much more easily. Another benefit that happens is it's an easier method of transferring knowledge to caregivers. If you think of the instance of the SLP, the speech and language pathologist that is dealing with toddlers that have delayed speech. I mean, it's a wonderful thing to watch SLPs get on the floor and get the reinforcements and have those kids actively engaged. And that's huge in getting them to breakthroughs and to start down the road of more developed speech. But ultimately, the goal has to be of transferring those reinforcement behaviors and those techniques to the parents. Telehealth gives that SLP the ability to be at the session, watching parents be the ones on the floor doing the high fives and the reinforcements and then engaging in all the techniques, and the SLP can coach and help transfer that knowledge. It's convenient and it's efficient, and patients love it. I think it's one of those things that you're going to find that the more you get involved with it, the more you find it's extremely satisfying for patients. Especially if you think of what goes on in the family therapy counseling, all of those traditional sorts of therapies can be done online, almost as if they were in the office. A massive convenience and a massive ability to reach more patients more effectively and be able to get better outcomes. With telehealth, it's one of those things we need to keep in mind that all of the HIPAA requirements, all the privacy, and all the standards of care apply to telehealth, just like they do inside of your office. So security and privacy, those are important, and they don't go away because you're on the line using telehealth. One of the important things to remember, and what Cogtrium has spent so much time doing, is developing a platform that meets all of the secure HIPAA requirements, the high-tech regulations, is FIP compliant on encryption and data management. It gives us an ability to say to the providers that are involved in Cogtrium, we have taken care of the security and the privacy framework. So as an individual provider, you're not stuck with all that extra cost and expense, and the platform will support you in that. It's the very reason why so many items that you would think would be obvious for telehealth, such as FaceTime or Skype or some of those technologies, just can't be used because they're not HIPAA compliant. The business associate agreements, the ability to prove to CMS and others that you are properly handling data, that the encryptions are right, can never be done with these large sorts of programs. So what we've done with Cogtrium is saying, let's level that playing field. Let's get a platform that just works for you. Well, thank you for listening, and I hope this has spurred some interest. You'll notice as you search through our help page and the frequently asked questions and the short videos that there's many of them there that will assist you in achieving better telecommunication results with your patients.